So, a little bit about me. My name is Marina Bryant. I'm an associate counselor here at Magnolia Wellness Psychology. I work with children ages 7 to 12, and I have specialties in working with anxiety and depression, women's issues, and ADHD. So, it's a pleasure to have you today. And whether you're a mental health professional seeking advanced techniques or someone looking for actionable strategies to manage anxiety in your personal life, this would be the webinar for you. So, what we'll discuss this afternoon, we'll discuss an understanding of what is generalized anxiety disorder, cognitive behavioral therapy applied to generalized anxiety disorder or GAD, mindfulness and relaxation practices. I have incorporated some techniques that we will actually practice here in this webinar. We'll go over the role of support systems, our approach here at Magnolia Wellness, and I saved about 15 minutes for question and answers. Overall, this webinar is going to be about 45 minutes long. But feel free throughout this webinar, just write out if you have any questions that you can have saved for later, okay? So understanding generalized anxiety disorder. What is generalized anxiety disorder or GAD? To start, let's clarify what GAD really is. GAD is often perceived as a condition where individuals are simply worried all the time, but this oversimplification doesn't capture the full picture. So GAD is a complex and pervasive mental health disorder, and it is characterized by persistent excessive worry that can significantly impair daily functioning. It goes beyond ordinary anxiety, impacting various aspects of an individual's life in profound ways. So in reality, GAD is actually more nuanced. So you may see, or you may know, or you yourself could be experiencing some of these examples. Like a young mother may constantly worry about the well-being and safety of her children, leading to sleepless nights and focusing on other tasks, even when there is no immediate danger. So, and then another one, a successful executive might be plagued by thoughts of failure despite their accomplishments, causing chronic stress, physical symptoms like headaches and muscle tension. So, clinically speaking, GAD is actually characterized by excessive worry, and that is disproportionate to the situation lasting for at least 6 months. It affects various aspects of life, from relationships to work performance and self-care routines, which I will go more into later on. So we know a little bit what is GAD. We said that GAD is a pervasive mental health disorder marked by persistent and excessive worry that severely disrupts daily functioning. However, there's no cause of GAD. It's usually a combination of biological, genetic, and environmental factors. So, for examples, in neurobiological factors, you have disruptions in brain regions responsible for the emotion regulation, such as the amygdala, prefrontal cortex, and imbalances in neurotransmitters like serotonin and dopamine contribute to GAD. And then, for example, with genetic predisposition. So genetics play a significant role. For example, if you have a family member that has anxiety or later down the line or earlier in the line, this actually impacts everyone. And then we have environmental influences, such as stressful life events, like traumatic experiences and chronic stress can trigger or worsen anxiety. So it's actually more common than you think. So according to the World Health Organization, anxiety disorders are the world's most common mental disorders, affecting 301 million people in 2019. I'm pretty sure there's quite a bit more since COVID-19, and I have seen it in my own profession as well. But this is probably just a little drop based on what we know so far. So now knowing how common GAD is, let's consider how it impacts our life at home, at school, and work, and actually with self care. So at home, people with GAD often struggle to manage day to day tasks, which can lead to a sense of overwhelming. For example, household responsibilities, which may seem routine, can become a source of stress. Anxiety often interferes with family time, making it difficult to relax or connect with loved ones. And it can add to disorganization in the home. So, increased stress due to GAD may lead to difficulty maintaining a peaceful living environment, making even simply daily tasks feel overwhelming. And then GAD at school and work. GAD doesn't just impact professional or family life, it also affects personal self care. For many, chronic anxiety diminishes the motivation to take care of themselves, leading to neglect of family, health and hygiene, and health, hygiene, and you struggle with tasks like managing your finances or keeping up with simple chores, which can actually increase the feelings of disorganization. And the feeling of disorganization actually leads to increased anxiety as well. And over time, the neglect of self care only exacerbates feelings of stress and fatigue, perpetuating the cycle of anxiety. GAD is daily self care. So, generalized anxiety disorder and self care. So, we have individuals with GAD may experience neglect of personal hygiene and health routines, leading to issues such as unkept appearance and lack of regular medical checkups. And then we also see that them having struggles with managing finances and household chores can become overwhelming, resulting again disorganization and increased anxiety about daily responsibilities. And overall, chronic anxiety often diminishes the motivation to engage in self-care activities, thus exacerbating feelings of stress and fatigue, which may further contribute to the cycle of anxiety, as I would like to call it the stress loop. CBT, aka Cognitive Behavioral Therapy for GAD. So, CBT is one of the most effective evidence based treatments for GAD, which I will show you in the next slide. It is widely recognized and it is effective treatment. CBT involves you being grounded and understanding that our thoughts and feelings and behaviors are interconnected, and that by altering negative thought patterns, we can positively impact emotions and actions. So, CBT for GAD focuses on identifying and challenging the irrational fears and beliefs that drive anxiety, therefore, helping individuals develop healthier coping mechanisms. So, what can we expect specifically in CBT? So, CBT is a structured, time limited therapy that emphasizes problem solving and the modification of distorted thinking. It's an active approach that requires patience to engage in specific tasks, both during sessions and outside sessions, such as with homework, to reinforce learning and promoting lasting change. And why is this so effective? Why you may see every single therapist or psychologist talk about CBT. So, cognitive behavioral therapy is particularly effective for anxiety disorders as it directly addresses the core issue of persistent excessive worry. So, by targeting the maladaptive thinking patterns that sustain anxiety, CBT helps individuals gain control over their anxious thoughts, thereby reducing the overall severity of their symptoms. Research demonstrates that CBT can lead to significant improvements in anxiety levels, with many individuals experiencing lasting relief. Additionally, anxiety disorders often co-occur with other conditions, which emphasizes the importance of discussing integrated treatment approaches to address these complexities effectively. And so, what I mean by this piece in regards to co-occurring with other conditions, so you may see GAD along with major depressive disorder or post-traumatic stress disorder, for example. So those anxiety may pop up within those mental disorders as well. Key techniques, and this is one of my favorite things about CBT. So CBT employs a variety of techniques to help individuals manage their anxiety. Two of the most common and effective techniques for GAD are cognitive restructuring and exposure therapy. So, cognitive restructuring involves identifying and challenging negative thought patterns, and individuals learn to recognize distortions like catastrophizing and reframing them with balanced, realistic thoughts. For example, one mistake will cost me my job. Or, as I will like to say, and I didn't put it on this slide, but I help my clients address the shoulda, coulda, wouldas. I should have done this. I could have done that. I would have done this. Sometimes even that can be a cognitive distortion. And then we have exposure therapy. So gradually, we expose individuals to anxiety triggering situations in a controlled way. And then this helps them to desensitize their fears and reduce avoidance behaviors, thus building confidence over time. And my approach to this, I tend to be very open and careful in regards to exposure therapy. Whenever my clients feel comfortable in exploring this technique, I explore it with them. And we take it one step at a time because sometimes it can be overwhelming. So, understanding how CBT works in real life scenarios can make these concepts more relatable. So, here's an example hypothetical scenario. So, imagine a 28-year-old man named John who experiences intense anxiety about his job performance. Despite consistently receiving positive feedback, John worries that any small mistake will lead to him being fired. So, in therapy, John works with his therapist to identify the thought patterns driving his anxiety, such as, if I don't get everything perfect, I'll lose my job. Like I said, who hasn't had those thoughts? So, through cognitive restructuring, he learns to challenge this thought by reminding himself of his past successes and that perfection isn't required for job security. As part of exposure therapy, for example, if we were to go that route, John would gradually face tasks he fears and what might lead to mistakes, thus helping him build tolerance to uncertainty and reduce his anxiety about work. So, what I would like you to do over there is to, if you have something to write with, like a paper or a pencil, or even you can type on your device, um, you can practice by thinking of a scenario. It doesn't have to be anything too hard or even too sensitive for you. But think of a scenario where you thought, for example, I'm going to fail this presentation and embarrass myself. Or if I do not do this correct, this may happen. And then I want you to challenge yourself by reframing this thought in a more balanced way. So, one example could be, I prepared well, even if I make a mistake, it won't define my overall success. Now, I'm not going to ask you anything about it because it's very personal to yourself. And so I just want you to practice it over there at your own time. You could just simply write this down, or even after this webinar, if you'd like me to go back to this, I can. Mindfulness and relaxation practices. All righty. So the benefits of mindfulness for GAD. First, we have reduced stress. So, mindfulness practices can lower stress levels by helping individuals focus on the present and break the cycle of excessive worry. Then, another benefit could be it enhances emotional regulation. Mindfulness improves the ability to manage and respond to emotions more effectively, reducing the intensity of anxiety symptoms. And then it also promotes relaxation. Regular mindfulness practice can help induce a state of relaxation and calmness, counteracting the physical symptoms of anxiety. So, different types of mindfulness practices. First, we got mindfulness breathing. So, first of all, I'm going to back it up a little bit. Mindfulness practices. So, these techniques of mindfulness are powerful for managing GAD because they help break the cycle of excessive worry. Mindfulness teaches individuals to focus on the present moment instead of dwelling on past mistakes or future what ifs. Regular mindfulness practice can help reduce stress, improve emotional regulation, and even promote relaxation. So, mindfulness breathing could be like, one simple sit down technique where you're just focusing on your breath. So, for example, um, your breath as you inhale and exhale, maybe every few seconds, and you may take this on for every few minutes. This can help you ground you in the present moment and calm your mind. Then we got the body scan technique. So this technique is where you focus on each part of your body, and then you notice any tension or discomfort and consciously releasing that tension. And this one is actually personally my favorite one at times because you could do it in moments and at the scenario moments. Like maybe you're busy at work or maybe you're at a red light somewhere. You can do this with mindfulness breathing too, as well. And then we have mindful eating. Oh boy. I didn't include this, but mindful eating means honestly, you're just being present with what you're eating and you're eating slowly, you're sitting down, um, you're taking your time, you're enjoying the present moment of eating. And now let's see, relaxation techniques. So breathing exercises may look like this. It involves taking slow, deep breaths to activate the body's relaxation response. For example, you may inhale deeply through the nose for a count of 4 and hold for 4 seconds and exhale slowly through the mouth for a count of 4. Personally, I admit this does take practice. And then you got the diaphragmatic breathing, where you focus on breathing deeply in the diaphragm rather than shallowly in the chest, which helps calm the nervous system. Then last but not least, my absolute favorite and the majority of my own clients' favorite technique involves the progressive muscle relaxation technique. So this technique has you tensing up your muscles and then slowly relax different muscle groups. So this method helps individuals become more aware of physical tension and learn how to release it. Like you may notice that you have physical tension in your shoulders or maybe in your gut or sometimes around your head. It's actually quite interesting where you may hold tension. But one way to help release this tension is you start with the feet, then you tense that muscle for a few seconds and then release. And then you gradually work your way up from the feet to the head. So practice time. So what I would like you to do over there is to get very, very comfortable. You may sit, you may lay down, whatever is comfortable for you. And what I'm going to do is guide you through a breathing technique. It's very, very short. And so I'm going to do this with you. I want you to take a slow, deep breath in through your nose. I'm going to count to 4. 1, 2, 3, 4. And then exhale slowly through your mouth. I count of 1, 2, 3, 4. I'm going to do it one more time. Inhale through the nose. 1, 2, 3, 4. I'm going to slowly exhale through the mouth. 1, 2, 3, 4. So notice how your body feels as you inhale and exhale. Feel your muscles relax a little more with each breath in and out. Now, how can we incorporate this type of mindfulness and relaxation practices into our daily routine? So, incorporating mindfulness into your routine doesn't have to be time consuming. You can practice mindful breathing for just a few minutes each morning or before bed. You can even set reminders on your phone to check in with yourself throughout the day. Mindfulness can also be practiced during everyday activities like eating or walking by staying focused on the present moment. And so, something I would like to add here is that mindfulness can look like anything. One thing that my professor taught me was that mindfulness can be simply you taking a moment to go get a cup of water. Or if you are in meetings all day, then maybe setting aside time for yourself for at least 5, 10, or even 30 minutes if possible to just stretch for yourself. And I like to tell my clients, you cannot take care of anyone else if you cannot take care of yourself first. So building a support system, which is very, very, very important when you're navigating anxiety. So managing generalized anxiety disorders is much easier with a strong support system. Whether it's friends, family, or therapists, having people you can rely on for emotional support and practical advice can make a huge difference. So you could start by engaging with loved ones. You can share your experience with them. Often they'll be more understanding and supportive than you might expect. And then you could consider joining a support group where you can connect with others who understand your challenges. And these groups often provide valuable insights and coping strategies too. Finally, make sure to lean on professionals when needed. Therapists, counselors, psychologists, psychiatrists, all of the above. Or even you don't have to go in person. You can also have online therapy and support as well, or what we like to call telemental health. So here at Magnolia, our approach is that we take a personalized approach to treating generalized anxiety disorders. Our initial intake sessions are designed to really get to know you and your specific challenges with anxiety. From there, we use evidence-based methods like CBT to help you work through your worries and develop healthier coping mechanisms. So, concluding with this webinar, please don't hesitate to seek professional help. We care about our hearts, so why can't we care for our minds?